So this is the most complex business on earth. I mean, running a car factory or an airline is easy. But again, if we look at the triple aim of the bill and look at the four purposes of a system as laid out in the white paper, then the fact we've got something called an integrated care system. This is the centre of the system, the network. The 20th century was the centre of the bureaucracy. The Ford Motor Corporation, the teaching hospital, the primary care service. But as Oliver Williamson, who won the Nobel Prize for Economics in 2008, said, some problems are too complex for either bureaucracies or markets, or even a combination of both. They need complex, adapted systems, of which the ant colony is actually the best example. So we have to start with, say, a thing called respiratory disease, because there's a bunch of vegan professionals absolutely committed, but they don't know to the nearest £10 million what we're spending. And they don't know whether they're spending twice as much or half as much as the respiratory people in the population down the road. But if we tell them what they're spending, ask them about the outcomes, and then introduce them to some other places with a different balance, that's the job of the integrated care system.
But in the world we live in, patient who is more complex than just respiratory disease and more troubled by social determinants of healthcare and might be affected by other conditions atypically, how do we break out of the medical model of respiratory to something about the consumer needs that are fundamentally defined by a number of factors?
So it is difficult, but I say we have to start where we are, getting the specialists to move away from just running a specialist department to starting to work with their colleagues and think about self-care, informal care by family and by other people with the same condition, primary care, secondary care, and if necessary, tertiary care, and to think in that way.